Welcome to My Therapist Says. During today's broadcast, I'll be your host and moderator as we present Navigating the Challenges of ADHD for Kids and Adults from Assessment to Treatment. Dr. Ben Coleman is our presenter. Dr. Coleman is a licensed psychologist and the Director of Clinical Training in the Master of Arts in Clinical Counseling program at Point Loma Nazarene University in San Diego, California. He completed his PhD at Fuller Theological Seminary Graduate School of Psychology in Pasadena, California. Dr. Coleman has worked extensively with children and adults, both in treatment and assessment across diverse hospital and outpatient settings. He is trained in several VA healthcare systems, including a clinical internship at VA Los Angeles Ambulatory Care Center, and he completed his postdoctoral fellowship in health psychology with an emphasis in HIV mental health at Harbor UCLA Medical Center. Today's event takes place before a live audience and live streaming. While offering practical biblical solutions, it's like having your own Christian doctor within the comforts of your living room. I hope you will sit back, relax, and take in these life-changing insights. Please join me as we connect with a live audience and My Therapist Says. Well, again, welcome to My Therapist Says, and I'm so pleased to welcome Dr. Ben Coleman to the platform. He's going to begin sharing with us a bit, and then we'll have conversation later about the topic.
All right. Hi, everybody. Thank you so much for having me. I'm excited to be here. So we'll just kind of get started, if that's okay, and I'll just kind of work our way through here. And I'm talking tonight about a topic, like Dr. Welch said, is difficult, ADHD, something that is, I think, not well understood by most people, and particularly the church. And you're here for some reason. Either you've been affected by it yourself, you have a child, a family member, somebody that's dealt with these problems. And so I wanted to just go, a couple things we're going to do. We're going to go over just the basics of what ADHD is so you can understand it. What makes it different from the typical garden variety difficult child? And what are the bigger implications for our culture and for faith and those sort of things when we talk about ADHD and what it means to have our children take medication? And there's so many big issues that are locked into this. So we're going to cover those things, and hopefully we can have a dialogue and questions about those big issues. So the main thing, what ADHD is it's a neurodevelopmental disorder, meaning that the brain is developing in an atypical way. It's I'm going to show you some research in a little bit that's going to show you that parts of the brain are different in these individuals. These individuals that deal with what we label as ADHD do not want to have these problems. They're not meaning to be off task or inattentive or distracted or impulsive. These are parts of their brain that are not working properly. And what we really have to keep in mind is this is happening from a very, very, very early age, really as early as you can remember. And I hope as you're listening to this, you can kind of check in with your own experience about what are you associating this with? Is this a child or something? And kind of think about how does this match up. So thinking about the ADHD child, we see it from very early on. There's the three core symptoms are inattention, but really what's most out there and visible to the parents early on are these sort of hyperactivity and impulsivity. And we see that in a lot of different ways expressed with peers, just in how they take to discipline, in just everyday life. And I have parents that sometimes say, you know, I knew from my child's sleeping patterns that this was going to be a problem, that something was up. And so we're thinking about this as an early childhood disorder, starting there. ADHD does not start later in life. There are attention problems that happen later in life that can start cognitive problems, thinking problems that may impact your work or impact your life in some way, but it's not ADHD unless it starts as a young child. And it also needs to be making sure we understand that these problems are not, every child in some way is inattentive, hyperactive, and impulsive. But these problems are more severe. They happen, they get in the way, right? So it causes some type of impairment, whether or not it's making friends, whether or not it's doing well in school, and they happen across multiple contexts, not just with mom or just with dad or something like that. So you see that the ADHD is on the rise, the diagnosis. And this is a little bit of a controversy with thinking about labeling. And we're sort of putting this label on our children of their problems as a disorder. And that's uncomfortable for a lot of people, understandably so. It's not a pleasant thing to have a child with a problem. But what I hope that you understand from tonight is that these kids are, when they have the support that they need, can do just as well as any other kid and have a perfect quality of life. So we see just the ADHD is a genetic disorder. Okay, so there's a big genetic component. Most problems that we see in terms of mental health or in developmental problems are both nature and nurture. And so there's tons of research that shows that ADHD has a genetic component. And so parents that have ADHD have a greater than 50% chance of having a child with ADHD. So that's significant. It's passed down. There's something that's happening in the brain that's different. And so this slide is kind of technical, but the take-homes here are that we can map on the problems we see in everyday life to the areas of the brain that are deficient in some way. They didn't develop right. And we see smaller volumes, so smaller size of fewer brain cells. We see reduced activity in those parts of the brain that are responsible for attention and those other higher order cognitive abilities that help people stay on task and inhibit themselves and wait before speaking and things like that. So it is genetic. We have to remember it as such. This isn't a parenting problem. This isn't necessarily the child's fault. Okay, this is usually a lot of different things going on. Something's happening in the environment that's causing the genes to be expressed this way, and we see the behavior, and that's what we're left to deal with. So school-age children, constant motion, squirming, they are fidgety. Really what we see mostly early on is this hyperactivity, like I said. And not just regular, normal kid hyperactivity, but so much so that they stand out and you scratch your head and say, most other kids aren't like this, to this extreme, or always, or in every setting, all right? There might be days where your child looks like they are very hyperactive. We see that there's, socially, there's problems. So thinking about kids when they're playing early on in life and they're making friends and they're trying to interact and they can't wait their turn, or they're impulsive in terms of grabbing toys, and it's difficult for other people to deal with children with ADHD. And so over time, you see that making friends is hard. So these are just a few things that we notice in school-age children, but again, in more severe ways than would be typical. All right, so this is why this is so important, and that we need to get this right early on, and being educated on it helps us to get this right, and thinking in bigger community picture, also being able to notice this in our children and intervene early on. So starting with the top right part of this slide, and you look at kids struggle with symptoms, okay? Kids, they deal with hyperactivity, they deal with inattention, and these things are starting to impact their life. Their behavior starts to get out of whack. They start doing things that get them in trouble. Their parents get frustrated. They start to get negative feedback from the environment. So their parents will say, I'm frustrated with you, go on timeout, or whatever's happening. Lots of discipline, lots of whatever's happening for them in the home at a proportion that's different from other people. Then at school, they have feedback from teachers. This is the bad kid, the class clown, whatever's happening as they're developing this reputation. They start to internalize that. We see a decreased self-efficacy, meaning their belief that they can do the things they want to do. So they're having a hard time on an assignment, and they keep getting feedback like, you're not ever listening. Why aren't you listening? And so it's starting to believe that and internalizing these messages that they're unsuccessful or bad kids or whatever they may be told. And then we have this negative feedback loop that drives a lot of problems later on. So as kids move through this negative feedback loop, they start running into social problems in adolescence. And this is the big problem, because what happens when you deal with somebody that is not pleasant to interact with? You stop interacting with them, right? And there's this phenomenon called passive ignoring that happens to kids with ADHD. And they start even getting ignored by teachers because they're too difficult to deal with. And we're talking here about kids that are, for some reason, under the radar and not being, there's no intervention, that they just sort of get by. And there's lots of peer rejection, social exclusion. They're more likely to be bullied and suspended, and 2 times more likely to be arrested, 3 times more likely to be incarcerated as adolescents. So the stakes are high. So into adulthood, okay, so I would also like you to be thinking about, okay, how do we differentiate what is these problems in adulthood when, as you see this list here, this can happen to a lot of people. When is this ADHD? And so this is, again, something that's been carried through childhood and adolescence and starts to infiltrate life, trying to find a job, moving out onto your own, autonomy, independence, building those things and realize, I'm struggling. I can't get things done. I have many tasks that are unfinished. I have a real hard time being on time. I can't organize things. And for a lot of folks with ADHD as adults, they've relied on their intelligence and hard work to get by. And now, for whatever reason, it's something's happened that's pushed them over the edge, and they are struggling and feel like they need help. And I oftentimes will get people coming to my assessment practice that'll say, I've always known something was wrong, and I'm just curious, is this what's going on? And they give me a list of all these things that are happening at work, and we can tell if there's these underlying attention problems. But again, that have needed to have been there since early on in life. So what does all of this mean? So that's sort of the developmental trajectory from childhood through adulthood. And I think the Bible can tell us a lot about this. And mostly because this is a really hard thing for parents. I keep going, as a parent of 3 myself, of little kids that all of them feel like they have these struggles at times. Really reflecting back on what does our faith say about this. And I think we can, from the Bible, we can glean these standards to which we can hold our kids. And also, as we hold our kids to these standards, we also hold intention to that these kids struggle with these things. And their capability to be this way, like having self-control and having patience and thinking and listening before speaking and staying on task, those things, those fruits of the Spirit aren't necessarily developed yet. And their capabilities for achieving those things is difficult, and that we need to recognize that as well. But certainly we can reflect it against these standards as this is what we want for our kids. These are our godly standards. Okay, so what happens, just say you have a thought that, okay, there's something going on here, and this is sounding like maybe my kid or myself were dealing with this. So we start with, you need to find somebody that can help do an evaluation. We're sort of in this world right now with ADHD, as it's known secularly, where the first move is to go to a psychiatrist because they're the ones that prescribe the medication. And that sometimes that can work, but not always. One problem we run into is that our assessment tools for understanding ADHD aren't very sensitive to these problems. And really what best predicts ADHD is understanding those childhood behaviors. If we can map out the behaviors that are consistent with ADHD from early on and see how it impacts life, that's typically good enough to make a diagnosis. But when there's other factors, and we might say this could be something else, is this anxiety, or is this other mental health problems or other cognitive problems, medical problems, we can use our cognitive tests. And so we put people through performance-based testing where they have to demonstrate their executive functioning, so their ability to inhibit responses or organize or shift from different sets and rules and things that ADHD kids have a hard time doing. We can put them through these tests and get a snapshot of what is their attention like in the real world. And that helps to flesh out whether or not these are real problems or not. And so what happens if they're not? So there's most of the time, it's not ADHD, actually. And ADHD is more rare than you would think. So right now we're at about 8 to 9% of children are diagnosed with ADHD, children really under 18. 10% males, 6% females. But for the people that present saying, or parents that wonder if their kids have it, it's oftentimes not. And so we have to make sure we are right because the stakes are high for this. So there's lots of things that it could be as listed up here, and we have to really refrain from approaching this saying, let's try out medication and see if it works. Because as I'm going to show you in a moment, stimulant medication, which is the gold standard treatment for ADHD, it works for all people because it's a stimulant and everybody's attention and cognitive abilities improve on it. So if you go through this process and you ever hear that somebody says, let's try and see if your child responds to this, be very skeptical, and I would caution against that. Okay. So let's kind of going back a little bit to when it's not ADHD. Bigger picture here. There's problems going on right now in our culture, obviously, especially with parenting and the cultural pressures for childhood, mostly academic and educational achievement. And so we want answers for why our kids are struggling in the classroom. The problem is not all kids are straight A students. Not all kids are good playing by themselves. Not all kids are, quote unquote, perfect angels. Some kids rebel. Some kids have these behaviors, and that's perfectly normal within their development. And so we really need to make sure that we are aligning our expectations with what is true for our children and not what we expect the culture tells us our kids need to be like. So big issues here are our expectations for them, feeling like labeling my kid, on one hand it feels weird to label my kid. I don't want my kid to have a diagnosis, but explaining the problem, that feels better than not knowing. And if I can get them help in some way, they can achieve. And then also kids I have to throw in with technology, right? That they're being conditioned to have shorter attention spans with technology. And that we have to recognize our children are changing and toward having more problems with this as well. Okay, so what do we do? So some may not want to hear this, but really what the research tells us and what I think is a common misconception in the church with regard to medication is that medication here is essential. I'm going to show you why in a minute, but it shouldn't be a scary thing. It should be something that we recognize as necessary early on to help prevent that developmental trajectory that I showed you that's very scary for these kids. But that's not the only thing that we do. We also want to look at changing the environment, parenting strategies. We want to look at how the school can help, and then alternative treatments that I'll talk a little bit about as well. Okay, so I'm not going to get into all the medications, but you may have seen some of these medications, and I don't want to get too detailed, but no, the main takeaways here are stimulant medications work on, remember those areas of the brain I talked about that are deficient in those brain chemicals? These medications work on those areas and bring them up to regular working order. They normalize the brain that's inefficient. And so oftentimes I will have parents that tell me, and you may have heard this yourself or have experience, that their kids changed overnight, truly overnight. From the day before being medicated to day after is a brand new kid. And so this is truly life-saving for a lot of people. So we know that with the symptom reduction that medication has right away, we can interrupt that feedback loop. And we also know, get this is why it's so important, is that there's neuroprotective factors, meaning if we intervene at a reasonably early time, not like 1 year old, 2 years old, but somewhere in that grade school range, if we intervene with medication at that point, we actually have research that shows those kids, their brains normalize to controls, in research meaning a typical brain, as opposed to the non-medicated kids. So those systems in their prefrontal cortex, dopamine is the neurotransmitter responsible, those pathways develop in a healthy way when we intervene with medication. So the earlier we do that, the better chance they have to have a normally developing brain. And so that's sort of a visual depiction of how we can interrupt this cycle. So some concerns. Obviously, there are concerns. They're largely controversial in the research. There's some concerns about growth rates, and that has been substantiated. And really, that has to do with bones maturing and fusing at certain places before full maturation. But it's either very small effect sizes, meaning that it's an unnoticeable difference, but maybe there's a little bit of a change, to it's unsupported. So there's some controversy in that. Being medicated does not, I repeat, does not lead to increased drug use or substance use later in life. ADHD diagnosis is associated with substance abuse later in life, but not the intervening with medication. So that actually is a protective factor against substance abuse later in life. Even though the common misconception is, well, stimulant use is an addictive drug. My kid's going to be addicted to a substance for their whole life. And when we look at massive groups of people, that's not true. You have to weigh the risk of medicating your child with the true risk factors and side effects there are versus the risk of not medicating and that negative feedback loop. So what can you do as parents? Behavior modification. All right, so these are the main things that we want to do. So we want to do structured time at home, predictability and routine, increasing positive attention. These are absolutely fundamental to a holistic approach to ADHD treatment. If a child's medicated, that's a great start, but the whole family has to change. And so we want to make sure that there's a lot going on at home where the parents are coordinated, they're consistent, they do not utilize punishment and negative threats as a way to change behavior, because it is crystal clear in our research that punishment works zero. It works for a very short time to suppress behavior. If you want to change long-term behavior, positive reinforcement. So you jump on any opportunity you can to reward your child for wanted behavior, and you ignore unwanted behavior. As hard as that is, trust me, I know. It is hard. But that establishes long-term change, and I've worked with many families that didn't think that was possible, and we worked so hard to implement these behavior plans at home, and their kids changed. Took a while, but they changed. So you've probably heard of some alternative treatments out there. You've probably heard of all the red and yellow dyes and everything that cause ADHD or exacerbate ADHD symptoms, and it's hard to know. There's lots of controversy. There's no consensus that any of that's legitimate. Dietary choices, I think having good nutrition in general is good for every kid, and ADHD included, and so that should be something you do. There's lots of claims out there that computer programs can change your brain. I've been on parts of big research studies that we've looked at these and found some promising effects, but it's still controversial. Try it all if you want. It can get expensive. And if something works, wonderful. What I rely on and what I tell parents is what does our research say when we can look at really quality research out there rather than companies trying to sell you something. Some kids with attention problems need more school-based services, but others are okay just doing outside of school stuff. But this could be advocating for your kid. That could be the main thing you do is you get with the teacher, you figure out what's going on, how you can best help them in the classroom, and it may be going through the IEP process or the 504 plan process. And that can be done with your school's disability office. Oftentimes you got to bypass the teacher, okay, because the teacher is either for some reason contributing to the problem or non-responsive, and you go straight to the disability office and have no fear in doing that because this is your child and they have rights. So to sort of sum up the treatments, really what research tells us is for both adults and children, medication. For adults out there, get with somebody, either a therapist or which would be great. Any licensed therapist that specializes in ADHD is wonderful because they can help you process all this stuff. But there's also these ADHD coaches out there, and be a little bit skeptical and do your homework, but they can help you with like day-to-day stuff of organizing your life around how to compensate for these problems for success. But getting on medication is likely what you're going to find is really life-changing for you. And again, nothing to be afraid of. It's something that's just going to help your brain do what it's supposed to be doing. Okay, big picture stuff again as we wrap up here and we turn it over to questions. So ADHD is not a spiritual problem. It doesn't mean somebody's spiritually deficient. It doesn't mean that their faith is lacking. It's a lifelong medical condition. However, we want to hold up these problems against godly standards and be informed of not necessarily by the world of what our kids should be like, but what the Bible says. And this maps on really well. We want our kids to be on task. We want our kids to have those fruits of the Spirit, patience, long-suffering, all of those things. And we can look to the Bible for that. We also need to really recognize that these children, and really all children that struggle in school and have some type of disability, are really important to the body of Christ, and that their limitations and their capabilities really signal that God is strong and that He's working in us, and that His power can be seen, and that He delights in that diversity in the weak. And so instead of trying to change them to be our paradigm of success and what our world says, that really knowing that these are the children, that Jesus would have spent time with. Can you go back one more time? Last thing I want to say real fast is this idolatry of educational success, I think is a huge key for parents in really catching themselves from going there. And that this isn't about what college your kid gets into, but it's about really doing what's right by your kid, and that we're orienting ourselves to Christ-like character rather than educational achievement. And ADHD can oftentimes we can look at it and say, oh, this is going to hurt my child's chances of being successful in a career and making lots of money and all these things. But our approach to helping them should really be reflected against what are those character things that we want them to have. So first steps, Chad is an Attitude magazine. Those are the two big ones that have tons of resources. Lots of the resources from this presentation came from there. And you can find support groups locally through them. And find a specialist that deals with ADHD in your community or at Skyline or wherever, and just get talking about it. And usually it starts with some assessment. Get a good evaluation to make sure you know what you have on your hands. But if any of this rang true, that's the first step.
All right. Well, please join me in thanking Dr. Ben Coleman for this great introduction this evening. Thank you.
Thank you.
Yes. Wonderful. I'd like to just dive back. There are several questions that have been raised. I received some text-wise, and if you have a question you would like to raise, please raise up the 3x5 card at this time. We have a couple that have placed their hands up. We'll bring those up front, and we'll talk about that. I invited Dr. Coleman to lean into this issue of why medication.
Yeah.
This has been, I've watched it for decades. You know, the question about this, I think it came in, actually ADHD came, 1987 in the DSM. It's not that long ago that was introduced. I mean, I'm getting older, so it seems like a short time ago. With this idea of medication, you're talking about kind of stimulant medication always works. Those were your words, and I'd like for us to unpack that for just a moment, just to go a little further with it. You were talking about the brain, of course, and that it's underdeveloping, and that the stimulant helps, and that all of us benefit from a stimulant. Could you go back to that idea?
And I don't mean to be flippant about that, but what I mean is, for that first part about that we all would benefit from a stimulant, meaning that our attention would improve on a stimulant, not that we would benefit. We should not be taking stimulants.
Right.
Yeah, right. But meaning that we cannot, our metric for whether or not somebody has ADHD cannot be whether or not they respond to a stimulant. Their attention improves on a stimulant. So, yeah, nobody should take stimulants unless it's indicated, because a typical brain responds differently. Their attention goes up, but there's lots of side effects and things that we know. It's a massive epidemic in education right now of people using stimulants as performance-enhancing drugs for their academics. And so there are, you have cognitive enhancement, and that's what I meant by benefit. But for kids with ADHD, we don't have the same type of response. We actually have a calming response where there's an ability to stay in the moment, present, and focused on a task.
So, for example, say you had somebody that had some form of anxiety disorder, which would be in a different camp. That would be a different diagnosis, even though ADHD would have some level of anxiety. But if you used a stimulant for someone with anxiety, they would become more anxious.
Correct.
Not settle down like someone with true ADHD.
Lots of dangers of that approach of just medicating without an evaluation first. Because if it's something else, we can exacerbate the problem or miss the problem entirely. But something like anxiety would be problematic because that would increase anxiety. So we don't want that.
Yeah, so it's really important to get a careful diagnosis. Actually, you do this work, and I've referred many people to you do this work in giving a very careful assessment diagnosis so that we're ruling out, in other words, saying this is not an anxiety disorder, and that, no, this is probably within the normal range of a child. Yeah. It's not necessarily abnormal, and it could be the educational system, it could be the parental, familial, family issues. So the child should be acting in a similar way in all of those arenas. So if they're very hyperactive at school, they most likely will be more hyperactive at home or with family, correct?
Correct. And that's a really good point you make, that the way we do that is we compare. In assessment, we compare kids against everybody else, thousands and thousands of the general population. Okay, and so we can look at if they're outside of that normal range, and when you have enough indicators that are outside the normal range, then we start to think this is a problem. And then yes, we see this across contexts. Not just one place. You know, if your kid gets rambunctious at grandma's house, that's one thing. If they are hyperactive everywhere you go without fail, that could be a problem.
Okay. That's important to look at, I think.
Yeah.
Because sometimes we'll have a teacher that will say, oh, my son is just really acting out or behaving in this way. And the parent will go, you know, I don't see that at home. Could we investigate why that is? Could be bullying. It could be a number of issues. It could be, as you had mentioned earlier, Dr. Coleman, maybe a learning challenge for whatever reason. It could be a minor one that's now becoming a major learning problem that could be corrected. So it's trying to make sure that there's a similar behavior among various areas of that child's life.
Correct.
Okay? There are several questions. This is great. We're going to have a great dialogue. We have plenty of time. The first question was texted to me. Is there a difference, Dr. Coleman, between ADHD and ADD?
Great question.
Does medicine help in both?
Yeah. So there's not necessarily a difference in terms of how we understand as a diagnosis. So ADHD really encompasses both what was previously known as ADD. Sometimes we look at there's inattention only, so the inattentive type of ADHD. But there's actually a lot of research that shows that might be a different type of disorder, and that really what we're talking about with ADHD is there's a early childhood hyperactivity and impulsivity. That fluctuates. Some kids are less hyperactive than others, but there's usually some component of that. ADD, there's not a lot of support for this being sort of as part of ADD, and it could be its own problem, but we're not really sure what that looks like. Stimulant medication, if inattention is the only problem somebody's ever had, I would question whether or not that's the same, what we call neuropathology, the same type of problem in the brain. Could be related to something else. But that's a great question. When you hear ADD, I think of them as synonymous. But we do want to, when we're getting specific about treatment, we want to specify what are we really seeing. Is it predominantly inattention? Is it predominantly hyperactivity and impulsivity? But we can use them synonymously.
Okay, this one is a real specific question, but it's someone here in our auditorium that wants to ask this question. Our son needs adrenaline and becomes depressed without it. And I know this could be even a question to a medical doctor, of course, as well. But Adderall has helped, but made his world so he stopped taking it. So the word was less colorful. So the question, are you able to respond to that?
Yeah, and yes, this has come up quite a bit, where individuals that take stimulant medications, so Adderall is a stimulant, is a very common stimulant for ADHD. It's that people experience this muted personality. I think that's what somebody called it in our psychopharmacology class. And they experience sort of like a lessening of their emotional experience. And absolutely, that's a side effect, and that not everybody has, but some have it and some more than others. Some people do not respond, not every child responds well to stimulants. Most do. It's about 75 to 85% respond well, but some don't. And those that don't, those side effects may outweigh the benefit you're getting. And it might be time to reevaluate with your psychiatrist. So I would say that is a problem. And if somebody's losing the essence of who they are and they're changing, I would be concerned, and I would talk to your psychiatrist or who's ever doing the prescribing.
Yeah, because you've talked about that a little bit, about how we could lose ourselves, our self-efficacy. That seems to be a very important piece when we're looking at ADHD, and that is if we prolong or permit the behavior to continue, that can lead to a lack of self-efficacy. Self-efficacy meaning, I think you refer to it, where I can feel as though I can make a mistake and then improve. Work on a way to overcome it. We say this to our university students, and that is, they don't do well on a test. Well, the one with self-efficacy will say, we'll work around Dr. Coleman. We'll find a way to figure out how he's testing us. Not cheating, but, find out. And then I'm going to work toward understanding that I'm going to do better on the next exam. That's self-efficacy, is it not?
Absolutely, yeah.
So this is a question that goes to the heart of this, is it possible to be cured of ADHD through better habits, training and building concentration, skills through therapy, etc.? So is it possible? This is a question that's often asked. It's a great question. So is it possible, Dr. Coleman, to be cured of ADHD?
I would love to answer yes to that, and because I'm a hopeful person and I'm an optimist, and I like to think that we can overcome any challenge. I don't know if I'd use the word cured, but I do think people can get to a point where it's minimally impactful in their life. With but I think you have to always be doing the things that are helpful for you to stay on track. If you stopped doing all the things that were helpful to you, meaning if you stopped using your planners, and you stopped doing your exercise and eating the way that was working for you, and maybe taking your medication or anything like that, you would likely, most people would have a recurrence of their problems, unfortunately. And it's just because it's a neurodevelopmental, it's a brain problem, rather than a curable disease that comes later on. It's really how the brain is from the beginning. And so, unfortunately, it's not necessarily curable, but it certainly is manageable to where you can have the quality of life that you want. You can live the life you want. Absolutely. And I've had many people in my life that I've met and worked with that have overcame.
Wonderful. This is so wonderful to have you on the stage here. This is great. This is going to be helpful to so many people even after the presentation and discussion this evening. Another question from someone here in the audience. My son is 17 years old. He has ADHD, so we're assuming by this question that he has been carefully diagnosed, which is what you were referring to a moment ago. So our son, 17 years old, has ADHD. He's been using weed. Now he started drinking alcohol. He plans to drop out of school. What should I do to care for our son at this point? As a therapist, it's something we could discuss.
Happening. Yeah.
Oh, yes.
It's terrible, and so I think it's not an uncommon trajectory. Like we saw, is that these are ways in which the individuals that struggle deal with their emotions, with their failures, with their whatever's happening in their life, typically socially at that age. And I would say, and please jump in too, I would say just presence of the parents, of the family, and weathering the storm. I think oftentimes these are the, for kids with ADHD, really low lows and maybe really high highs, the bigger waves than most kids would go through. But being there and being consistent and talking and asking about what's going on and not shying away from drawing boundaries and limits. And this is where you up your parenting. Even though they're kind of at the edge of how long they're going to be around, this is the time to go all in on engagement.
So sometimes in parenting like that, we become anxious. I'm very sorry to hear this as well. That would cause me as a parent to be very anxious.
Yeah.
And my anxiousness could prevent my son from hearing my love, that I really do care for you.
Yeah.
So if you're my son and you're behaving like that, is to say, I really care about you. Is there anything I can do to be of help? Our tendency would be to say, you need to stop if you don't leave the home, if the 17-year-old is in the home still. So it's actually sharing that positive. I think you were referring to Ed Thorndike and the whole development, that the positive this builds on the back of actually B.F. Skinner and operant conditioning, and this idea that we used to think that negative consequences will be more effective. Like when I grew up, the coaches would scream, yell. It was all negative. Well, maybe I was not a very good player. That's probably why it was negative. But on the other hand, positive reinforcement in this case for parenting could be useful. Maybe if you have not shared, I really do love you, and genuinely you don't want to fake it to make it. You really want to be able to say authentic issues. But what can happen, isn't it, at this stage, is that if the person is self-medicating, they're not learning self-regulation. Self-regulation goes back to the self-efficacy that we mentioned a moment ago. You've mentioned, I re-mentioned, and that is for the young person to be able to self-regulate, which means that I can tolerate some level of anxiety.
Right.
So there's a tendency in self-medicating, which is what I believe this question is referring to partially, is that self-medicating will prevent me from going through the normal stages of development.
Yeah.
So we do want to see a way for that to be changed, and maybe some education can help.
And I would just reiterate, too, what you're saying. In these moments, it's really easy to fall into that focus on the negative.
Yes.
And these behaviors are bad, and we have to get rid of them. And that's when it takes just the sense to say, what good is happening right now, and what can we jump? I love to say, jump on the reward. Anytime you have a chance to reinforce something you like, something that's good, you do it, and you do it big. And so that focus on the positivity in the midst of all of these really challenging, difficult things.
Yeah, some people will even go back to a scrapbook if you make scrapbooks, or a photo, or something that was fun and enjoyable, and you would reflect back on that, and you would help yourself be more mindful, meaning being in the present, but remembering that there were positive days, positive experiences with that child. That's so important that we have that inside of us. Otherwise, I would just be anxious all the time, because it's very anxious producing. This next question asks, does reducing screen time, you talked about social media, does reducing screen time reduce risk of ADHD for a child? Or are there other things that prevent or reduce the risk from ADHD developing?
There's not a lot of research that shows that we can sort of that we can reduce the likelihood of it happening early on in life, kind of like this idea that kids with ADHD are sort of born with it. However, there's lots of research that shows that decreasing screen time is good in every possible way you can imagine for a child's cognitive development. And so the answer is always yes, reduce screen time. That might be my bias, but it's so overwhelmingly clear that excess screen time, not reasonable amount of screen time, there's going to be some screen time, excess screen time, typically more than an hour or so a day, is harmful, and harmful for the development of regular attention, like normal attention as well. So it won't necessarily screen time won't cause ADHD, because ADHD symptoms are apparent before a child really sees a screen. But it could certainly contribute to the development of a worsening problem with kids with ADHD, that their attention is even more impaired than it would be elsewise. But that really, for all kids.
Very good. Thank you. These are great questions. We're wanting to utilize our time here. This particular question focuses in on an 11-year-old female. We are just now at the beginning of diagnosis for our 11-year-old female. Should we seek a psychologist or a psychiatrist, or can you help us?
Great question. Let me say real quick, too, and thank you for that question, because I wanted to just say that ADHD for females and males, girls and boys looks different. And we see it as oftentimes, as like I told you, about 10% for males, 6% for girls. But it looks different because with males, there's a behavioral component. It's out there, it's visible, it's the class clown, it's goofing off, it's distracting other people, it's behavioral. For girls, it tends to be more internalized, so withdrawing or daydreaming or something that's happening at the internal level that isn't always seen. And so it's not uncommon for girls to be a little bit older at diagnosis. I would say that if you're suspecting it, you're likely going to, it's okay to go to either, and I'll tell you why. A good psychiatrist will do a thorough history, and if it is so clear-cut, they may feel comfortable saying, okay, this is what the diagnosis is. If there is any indication that it might not be, they will refer you to an evaluation with a psychologist. I think finding a good psychiatrist is, just because, not that psychiatrists are bad, but because there's just not as many of them, is a harder thing to do. And so if you can find a good psychiatrist, that's actually a pretty good place to start. And you can be very clear that you want to make sure this is what it is, and that you're open to an evaluation, and be referred for a comprehensive evaluation that includes cognitive testing and other testing.
Very good question. Yes, this is a little more lengthy. This question is a text that came in. We can read this. It's an important question for someone that's either found us online or is here this evening. I have a young child, almost 5, who really struggles with the ability to focus. It affects every area of his life, so much so that he forgets he's on his way to the bathroom. He frequently has accidents while standing in the bathroom. This happens due to distractions along the way, even when I'm walking with him to the bathroom, prompting verbally and with physical or verbal cues. I feel lost as to what to do in addition to this to help him. I have to be the person that sees physical cues in order to recognize this need because of his high distraction. How am I supposed to deal with this at home as well as when he goes to school? In other words, what can I do to help him become more independent in putting on pajamas, shoes, getting in the car, all the little tasks that I have to walk each individual steps through? Getting in the car seat is so many different steps. We have to open the car door, climb into the back seat area, climb into the car seat, put the right arm in the seat belt, put the right arm in the seat belt and put the left arm in the seat belt and then buckle the three-step buckle. This is a painful task, and I often find myself doing all of it because it takes too long and too many promptings. Can a person have a serious focus issue without hyperactivity and still be under this blanket is the question.
Yeah. Wow, that's a great question.
Mm-hmm.
You're definitely dialed into your child, I would say.
Yes.
And so when I hear something like that, like forgetting that they're on their way to the bathroom, or going to the bathroom when they get there and forgetting where, just it's happening without going, these things are so far outside of the what would be a typical child experience as this parent is feeling, that it should raise red flags. That and if it's happening, that it's so severe, this is likely a situation in which I would probably recommend talking to somebody about, figuring out, could this be an attention problem? If you're not seeing hyperactivity or you're not seeing impulsivity, it still could be. It's not there's no scenario which there's just inattention. It's just more common and more likely that you're going to see those more hyperactivity behavioral markers first. And again, things like learning to do all those things, that can be a struggle for a parent. And so sequencing of daily tasks like getting ready and getting in, and if there's like one thing you see, like, my kid just has a really hard time remembering to put their shoes on, that's a kid, right? We got to find when the evidence for doing things that are so different from their peers tips the scales. And so that's why if you're giving somebody an example from every moment of the day where your child is inattentive, then that should clue you into there's something that doesn't feel right. If you can pick one thing that, like, this one thing bothers me because they're inattentive here, it's likely they'll probably learn that and it'll be okay. Just my gut reaction here, and I'm not diagnosing or anything, but it sounds like there's something going on, just because it seems so extreme. And so my recommendation would be to talk to somebody about it. I don't know what you think about that.
I think it sounds very complex, and I would also suggest with what you had already said is that this is a parent that's really tuned in, trying to make sure that this child is healthily cared for. So I think that's good advice. It seems very complex, and that complexity could prompt us to look for additional and professional help.
Yeah.
Yes. These are great questions, great responses. This particular person, this is a text question here from either someone in the auditorium or someone listening. Sounds like my microphone, there it is. That it says, I see there's a lot of programs to help kids with autism and with social skills, but nothing for kids with ADHD. Of course, you talked about some programs that are available. Is there help out there socially for them? And also that health insurance covers. I know you're not a professional health insurance.
No, these are such good questions,
These are great questions.
Because these are the practical questions. This is what matters.
Yes.
Yeah, why is that? I don't know.
Yes.
Yeah.
So when we look at this, there are, for autism, there are growing numbers. I had a patient just yesterday and working on a son and had gone to a support group, and it was very helpful to the family. But the question is, with social skills, how might we help them with with ADHD, do you know of any groups that are meeting even around San Diego or?
I know there are. I don't know any specific off the top of my head, but I
Okay.
do know that these do exist. Now, the difference between ADHD and autism is that ADHD is sort of, I think autism is so widely accepted as a
Yes.
major problem, and now it's socially acceptable, and there's far less stigma around that. I think ADHD it's one of those things where it's like, some people don't believe it exists, and these kids kind of are just under the radar and do okay, and so, finding where to go with them, it's just tough. There are groups, and so I've given a couple of resources like CHAD, Attitude. They have local chapters that have support groups for parents. There are practices around San Diego that have social skills groups for a variety of problems that are not autism. Autism is a very distinct approach to treatment that does not overlap with really anything else. ADHD falls in with a lot of other behavioral problems for kids, and there's lots of groups out there. I think one reason why too is that we know that ADHD it's so responsive to medication that tends to be the default for treatment. Although we really encourage there to be a holistic approach, doing a lot of different things, a lot of different contact points with the child. And I'm happy to figure out if there's some referrals that we can find, and some specific ones out there. But I know there are practices out there that have groups.
Yeah, and regarding health insurance covers, absolutely. I know our office at the Center for Enriching Relationships, we have many children, and I don't want to say all insurance covers this, but since it is a genetically predisposed issue, maybe not predisposed, but it's genetically driven, even as you had clearly articulated, that's what insurance is to cover. And they will cover biologically driven issues, and that's what this is. So you should not have a problem with that necessarily, however, depending upon what your insurance covers. But overall, that should be available to you, of course, depending upon your insurance. Yes, there was another question that asked about kind of a combination of the differences between, say, anxiety, OCD, and ADHD. Someone has mentioned that they have a child that has every symptom, they believe every symptom of ADHD. And the question is cognitive behavioral therapy good for someone who has anxiety, OCD, and ADHD? That's a full question there.
Yeah.
What are your thoughts about that, Dr. Coleman?
Well, speaking to the what's the difference between all of those? They're all distinct, but there are certainly overlaps in terms of cognitive or thinking symptoms. And oftentimes we have to figure out, is something anxiety or ADHD, especially with adults, young adults. I see lots of young adults that wonder if they've been misdiagnosed or not diagnosed and should have been with ADHD, but has experienced a lot of anxiety. The problem is people with ADHD, oftentimes because of that feedback loop I told you, develop depression or anxiety, highly comorbid, meaning happening together. So these are common problems for folks with ADHD. OCD is pretty separate. I'm not sure how helpful it would be to get into what OCD is, obsessive compulsive disorder, but they're all kind of they're in three distinct categories of diagnoses, but they all share these thinking problems of inattention and something that is a challenge to get tasks done, and for different reasons for other people. But cognitive behavioral therapy, absolutely. That tends to be highly researched. There's a lot of evidence that cognitive behavioral therapy is fantastic for anxiety, first of all. For obsessive compulsive disorder, it can be helpful. There's some better cognitive therapies, specific ones. One called exposure plus response prevention. That's sort of a part of cognitive behavioral therapy. For ADHD, yes, there can be. it's not so much as like the main therapeutic approach. There can be some benefit from looking at people's thoughts and how to disengage or change thoughts with ADHD, but it tends to be more effective for anxiety and OCD.
Okay.
And not so much. That wouldn't be our first recommendation for therapy. We'd want parent training. Would be our first therapeutic recommendation.
Okay. And one person asked a question, which we didn't go into, and you specifically mentioned that you were not necessarily going to go into the details of this. Could you help us to understand some of the medications?
Yeah, absolutely. So there's the psychostimulants are a class of medication that have been around a long, long time to treat a variety of things and are highly controversial. They are also known as speed in a lot of ways, and originally started that way. However, therapeutically used, they are extraordinarily effective for ADHD and attention problems and calming kids down. And they work by increasing the neurotransmitter dopamine in the brain. It's a neurochemical, a chemical messenger that helps brain cells communicate with each other. And in the ADHD brain, like I said, this neurochemical is somehow deficient, not working in the right way. Not necessarily not enough, but just not working in the right way. And so increasing that helps that dopamine make sure those attention parts of the brain work. There's also, and so that's usually the first approach. There's also non-stimulant medication for ADHD. Some psychiatrists will use antidepressants to help some kids with ADHD that work on a different neurochemical with similar results. And there's also a couple others. The one, guanfacine is a one that's been used a lot lately. Clonidine is another one, and these work on adrenergic receptors, just a different part of the brain. So there's different approaches. The main one is stimulants, and they help to boost dopamine levels in the brain, which dopamine, again, is that neurochemical that is in that attention center.
Okay, very good, very helpful. So part of what you're referring to in that part is the three parts that you talked about, kind of interrupting the behavioral loop. Number 2 is the neuroprotection factor. And then number 3, which is what you're referring to now, is the normalizing the prefrontal cortex and other portions of the brain, but to grow it and to help those connections.
Can I say something about side effects real fast? Because we all worry about side effects of medication. There are side effects for sure. The side effects typically are loss of appetite. Okay, so it's sometimes a challenge to get kids to eat when they're on medication, and so I've heard parents say that the child comes home with their full lunch in their lunchbox every day, and even if they put in chocolate bars. So there are concerns for that. Insomnia. So this is, remember I said speed. These are people have used them for diet pills, not the exact same compounds, but similar properties. So we have this is an excitability that's happening, this sympathetic nervous system arousal, and so kids sometimes have a hard time going to sleep. But your psychiatrist can help you manage that and do the medication regimen in a way that really limits those side effects.
Okay. Well, we have responded real well to these questions, and would you join me in thanking Dr. Coleman for his presentation and for joining us this evening? It's been fabulous.
Thank you.
Thank you, Ben. It's so great to have you here. Hope we can have you come back.
Love to.
Wonderful. And you do have your practice, and your practice is at the Center for Enriching Relationships.
Yep.
All you have to go on is enrichingrelationships.org or cersandiego.org, and they can find you, find your bio, find your phone number, and all of that. That's available. And there's one other question. I didn't actually get to this one. It just came in, and if we do have. Do you mind if I just do that?
Let's
I've never
do
done
it.
this before, but it's last question that someone just texted. Could be someone over in Africa. I mean, we send out 12,000 brochures each month that we produce this. But the question here, if we can, we've got 4 minutes, so we'll make this quick. But we pulled our daughter out of school because of her self-esteem going down rapidly, being bullied, social issues, and too overwhelmed with all, and are now homeschooling our 8th grade and plan on homeschooling, it says. Yes, here it is. What are your thoughts of homeschooling? And when I say homeschooling, she is in a few small co-op groups. So the self-esteem, being bullied, social issues, too overwhelmed, maybe some anxiety, and this may be beyond, of course, our scope of tonight's question, but I wanted to honor a question that are coming in. We try to.
And it's such a good question. I think this is a question I hear a lot, and I'd love to hear your thoughts on it too.
Yes.
Because these are legitimate concerns,
Yes.
and I can only imagine what this parent is feeling like dealing with their child being treated that way at school,
Yes.
and especially if you attempt to address these situations with administrators, with other parents, with whatever groups of parents are there at the school that are supposed to advocate for kids, with the kids themselves. When you come up against sort of a dead end with that, what do you do? And for homeschooling, what do you think?
Well, I think it's important to weigh back on the self-efficacy. Well, the self-esteem of a child is really important, how they view themselves in relationship socially to others. The way God created us, we're meant to be in relationship, and when those don't go well, and if we leave a place, then if we remove them from a situation, and they don't have choice in that, it's very important. My wife Robin and I did this with both of our kids. We removed them from a particular school setting that was not working. So it's not that you shouldn't remove, but it was after much discussion and a lot of choice on their part so that they were developing self-esteem and not being denigrated, their self-esteem being denigrated while that move was made. Sometimes, however, we can start moving kids from school to school or to homeschooling, and then we're isolating them. And I know you said co-ops, whoever the person was that mentioned it, but that socialization is so critical, and it needs to be positive. That's why so many people go to homeschooling other options. It's like, I want positive social, and maybe it is more involvement at your local church that's supporting children. And you mentioned advocates for children. So very powerful question. We had a few minutes left. We're actually 2 minutes from 8 o'clock, which we end right at 8. So I wanted to try to respond to that question and get advice from many people. The Bible talks about having godly advice from multiple sources can be very helpful to us, and getting advice with people who actually know children. They have background skill, they have training, and they have a passion for children and parents. By the way, we're going to have a specialist in September that will be here with us, Dr. Joe Price. He's a specialist in adoption and children, a professor at San Diego State University. He's here once a year, and he'll be with us again in September. If I may, as we close out this evening, we're 1 minute until 8. Just like to mention our next My Therapist Says will be with Dr. Julie Hayden, another clinical psychologist who will be with us. She's been here numerous times, is very adept in combining, just as Dr. Coleman has shown this evening, of combining biblical truths with science. And the title is, and you can see that, I believe, up on the screen, Friends and Family First Aid, Helping People in Difficult Situations and Continuing to Keep Your Own Boundaries. I love that title. I think it's going to be very helpful. Invite your friends. They can live stream it if they're not able to be here. Let's close out with a word of prayer this evening, shall we? Thank you for coming. Heavenly Father, thank you for the ability to talk about your truths. Any science research comes from your heart, actually, because any truth that is relevant comes from your heart. And you love each of us. And I pray your blessing upon those that were able to be here this evening, those who live streamed, and those who will be listening to this later, where this broadcast is archived. So we love you, we bless you, we thank you for the opportunity to discuss these important issues related to our wonderful children. What a wonderful gift these children are to each of us, and we give you praise this night in Jesus' name. Amen. God bless you. Have a wonderful evening. Thank you for coming to My Therapist Says.